You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, reversing fibromyalgia. With us, we have an expert on this topic. He is the author of the Fibro Fix, Dr. David Brady. Dr. Brady, welcome to the program.
Thanks, Randy. It's great to be here.
Now, we've had you on the show before, so
Yes.
Thanks for coming back. Now, for people, well, first off, you've seen reversals in fibromyalgia over the years?
Oh, absolutely, I have. Yeah, I've seen so many thousands of patients who have come in diagnosed with fibromyalgia, or many patients who just think they have it for some reason. They may have gone on to some website and diagnosed themselves, so to speak, or talked to a neighbor, or just somehow came to the conclusion that they thought they had fibromyalgia, and they come in, and oftentimes we can recover them and get them back to feeling healthy and vibrant.
Now, I tried to push you, right? And I know that we have legal disclaimers. We can't promise certain things, but in your clinical practice, and you've seen well over 5,000 patients, you told me, that you've seen over 1,000 patients, because it's not, you don't just have a fibromyalgia practice.
Right.
As a naturopathic physician, you deal with all types of situations, but you've seen over close to 1,000 people that were diagnosed with fibromyalgia, been given that diagnosis, and now they're pain-free. Is that true?
Yes, and I would stress that even the medical literature is pretty clear that of that 1,000 that would come in diagnosed, even if they were formerly diagnosed with fibromyalgia, about 2/3 of them have probably been improperly diagnosed.
So they don't really have fibromyalgia?
Some of them don't. Some of them do. They all have real problems. They all have problems that are causing a very common constellation of symptoms, whether it's pain, fatigue, anxiety, depression, inability to sleep, or waking up feeling like they didn't sleep even after they did. Vague intestinal problems. Sometimes they're also diagnosed with irritable bowel syndrome, for instance, but they're not all the same person, right? They all have different things wrong with them. Some of them do have this, what we call classic fibromyalgia.
Now, what is that, by the way? So give me a definition and the symptoms.
Right. Well, classic fibromyalgia is a pain processing disorder. It's where the central nervous system, including the brain and the spinal cord, is not interpreting signals coming in the right way. So things that to a normal person might be something that's not painful. Let's say light touch. Someone just brushes your arm. To you, it's light touch, but to someone with classic fibromyalgia, particularly if it's severe, it might be interpreted as pain.
Like an exaggerated
It's an exaggerated response to things coming in. And so therefore, even though these patients often would describe their pain as pain in the muscles, right? Pain all over the body, there's really no problem in the muscles. The problem's not in the body or in the muscles. The problem's in the central nervous system on how it's being processed.
So you're getting signals sent to the brain that you're in pain when you're really not in classic.
Correct.
Interesting.
So therefore...
But it's all over the body. Like you don't have fibromyalgia if it's just your legs.
No, absolutely. And that's one of the diagnostic criteria. You have to have pain everywhere. It's called global pain. And that means it needs to be pain above your waist, below your waist, on the left side, on the right side, along the midline of the body, and out in the periphery of the body. So it's not, this pain processing disorder doesn't discriminate on area of the body. So that's one of the first things we have to do as a physician, is to determine, is this person's pain really everywhere, their perception of pain? Mm-hmm. In other words, it can't be inflammation and pain in the joints. That's not fibromyalgia. All right, that might be an inflammatory arthritis or some autoimmune condition or some degenerative problem, but it's not classic fibromyalgia. So we have to make sure they have pain everywhere, or a perception of pain everywhere. We have to make sure they have many of the other components of what is known as a central sensitivity disorder. Since it's mediated through the brain or the nervous system, there are other things associated with that dysfunction in the nervous system. Things like mild to moderate depression, things like anxiety, even panic attacks.
So when you fix when you reverse fibromyalgia, the other things go away.
Yes,
like IBS, depression.
If you're successful with treating classic fibromyalgia, generally that constellation of symptoms in total reduce significantly, if not totally resolve. Everyone's an individual, so there are some cases that are much more difficult than others. We're talking about reversals, and it's true, they can get reversal of their pain and some of their other symptoms, anxiety, depression, sleep disorder, and the like, but really, what's reversed is the dysfunction in their life. Because when you're chronically in pain, when you don't feel like you ever are refreshed from sleep, if you have depression, if you're prone to panic attacks, your life is not a normal life. You are very reluctant to do certain things that you might enjoy to do that you did previously. An example of that is people who are suffering from this disorder, they may no longer go to the gym because it hurts them to go to the gym. So then they gain weight. Then they feel bad about themselves. So it changes their whole psyche, and they stop doing the things they love to do.
Anticipating you coming here, talking to my medical doctor buddies that have been on the show, they say, I don't know, I think it might be all in their head. I don't really know. Maybe they're eating their pain. I mean, I'm hearing all kinds of things.
Yeah, you do hear that. You hear it
because
less
I guess
and less.
It's invisible, right? I mean, they have pain.
The very problem, Randy, is what I said before. You know, the pain is a perceptual pain. Doesn't mean it's not real, but it's a perception. So if you go looking around the body, if you do EMG studies, you do MRIs, you do all these lab tests that doctors want to see sort of this objective evidence on where the problem is. You don't see that in fibromyalgia. So therefore, it's outside of their normal thinking and paradigm, and they start thinking, hey, it's not really real, it's all in the patient's head. Well, in one way, it is all in their head, right? Because it's a problem in the way their brain is processing this information. So it is in their head, not in the sense that they may imply, being that, or meaning that they're making it up. They're not making it up. The pain is very real. It's just not pain out where they feel it. It's similar to, have you ever heard people have an amputation or they lose a limb, and even years later, they have pain in that limb? It's called phantom pain. That's a perceptual pain. The limb's not there anymore. So the problem's clearly not in the limb.
So it's kind of the same mechanism that's causing this.
It's very, very
pain.
similar. Yes, it is. But instead of just being in one location where that limb used to be, it's actually in the entire body.
In your book. And I've read your book, by the way. It's an exciting book, by the way.
Thank you.
I thought, you know, in preparing for this, I thought, oh, I can't believe I have to read a book on fibromyalgia. But it's about nutrition. It's about health. It's a very optimistic, view.
It's about empowerment for these patients. They have to be engaged in their own recovery. It's not about passively letting some doctor give you something and you're all going to be better. There are steps you have to take and commit to recovery. You need to be actively engaged in it. But there's hope. These people recover. You know, some people have an attitude that fibromyalgia and other disorders like that are, these sentences, right? You can never recover from them. You can recover from them.
So in your book, by the way, is this meant that a patient with fibromyalgia could read this on their own, make the necessary changes, or do they have to go to your Fibro Fix website to get more of the protocols? Or do they have to work with a doctor to get this done?
No,
so I guess that's several questions.
Yeah, the book was meant primarily for that patient who either was diagnosed with fibromyalgia or thinks they may be suffering from fibromyalgia. And it's meant to empower that patient. So what the book does is first, it starts to explain a little bit, what is this thing called fibromyalgia, all right? And then it works them through different gateways, through questionnaires, through having them examine their own experience, their own symptoms, and work with their healthcare provider or physician if they want through this process to first of all determine, is it highly likely that I have classic fibromyalgia, or are there too many things about my story that don't add up, where I may have something else? And there are many things that are very commonly misdiagnosed or mislabeled as fibromyalgia, and I call them the great fibromyalgia masqueraders.
All right.
And the doctors and healthcare providers right now, Randy, getting out of medical school this year are not properly trained in this disorder. They do not know how to handle it. I was not properly trained. I had to go become my own, self-taught expert on this because I graduated long ago when they barely talked about this at all. And if they did, it was in a very dismissive way. But when I got out into practice, I realized very quickly there were these patients out there, their problems were real. I was not equipped to deal with them, nor were my colleagues. I need to figure this out. So I basically started reading everything in the literature on fibromyalgia, and I reached out to the world experts on it and basically taught myself to be an expert on this. Now then...
And you've seen reversals.
I have, but then I went into publishing, into research, and became one of those experts myself. But the book is really meant for that person to first of all answer a fundamental question. Do I likely really have classic fibromyalgia, or do I have one of these other disorders that are commonly misdiagnosed? And I break those into what we call buckets. And I send people through these gateways, if you will, to try to find out which bucket am I in if I don't really have classic fibromyalgia? And I try to give real workable action steps and solutions no matter where you fall in all of those buckets. Things that you can do on your own, ways that you can change.
I mean, you have a 21-day program.
I do. That's a 21-day upfront program that everyone does while they're reading the book trying to answer these questions. And what it does is it simply is a bit of a metabolic reboot, if you will. It helps them get off many of the foods that can upregulate inflammation in the inflammasome. So regardless of whether they have fibromyalgia or not, if they have chronic pain as part of their component of issues, then getting off common things in the diet stream that make us more inflammatory and more prone to pain
Seems like an
is a
easy diet to
beneficial
follow.
thing.
I look at some of the recipes.
It is, but also we're doing things and having the patient take specific supplements or botanicals that are really good to help pull toxins out of their system, to help them make more energy, to help the mitochondria, these little energy factories in the cells, work better. So we're improving their nutrition. We're improving not only from diet, but from the standpoint of some supplements they may be taking at least temporarily, but we're also getting them to start doing practices that are very good in these type of conditions, because there's a lot of stress involved and stress aberrant sort of activity in the brain. So we're bringing them into or introducing them into ways to quiet the mind. So everything from guided imagery or progressive relaxation, looking at other ways that they can calm themselves that resonate with them. We give lots of options and
What's
lots
the
of
fastest
references.
turnaround you've ever seen? By the way, somebody with classic fibromyalgia, muscle pain throughout, or pain, I should say, throughout their body. What's the fastest you've seen?
If they really had classic fibromyalgia, this central pain processing disorder, usually within a couple of months, they can be remarkably better. We can have them feeling significantly better to where they notice the difference, even through that 21-day program, by the time they come out the backside of it. Randy, I have an example of a patient that came to see me. And when she came in, she was in her late 30s, okay? She came in complaining of pain all over the place. She was fatigued, she was anxious, she was afraid to be in crowds because she almost had a panic attack-like experience often. She was able to sleep, but she would sleep 14 hours and wake up and she felt like she never slept before. She had tremendous constipation. Occasionally she would have diarrhea as well. It would go back and forth. She had a lot of bloating and distension, a lot of intestinal issues. And she came in. She was so disabled, she couldn't hold a job. She was living with her mother again. So she was very depressed about that and stressed about that, not because she didn't like her mother, but because she was 38 years old and didn't think she should be back living with her mother. When we worked her up, it became apparent to me she really was one of these classic fibromyalgia patients. She met all the criteria. She ticked all the boxes, okay? So I knew it wasn't going to be one of those super easy ones, and we'll talk about how they can be, how some of them are very easy, but usually they're the ones misdiagnosed, okay? But the ones with true classic fibromyalgia, you have to start building them up from the ground floor. By the way, when we did her medical history or intake, she was on 12 medications at the age of 38. And the best we can tell, she was on 6 of those for specific symptoms, anxiety, to sleep, pain medication, and the like. And she was on 6 others to control the side effects from the first 6. So at some point, it's sort of silly, right? It's insane. Someone that young on that many medications, half of them to counteract side effects of the others. So
she must have been like a zombie. I mean,
she
when people are
was
taking all these.
She was like a zombie, and that's how my staff sort of, interpreted her. And when I started working with her, I actually reached out to all of her different physicians because she had, this specialist and that specialist. She was sort of in that. That system where the doctors didn't want to deal with her.
Because you can't figure it out, obviously.
No, she was the person when they see her on their schedule, they go, oh no, right? What am I going to do with her? I've tried everything, right? So they start referring out to other specialists. So she had been all these specialists. They're all trying to do something, right? So they all give her a medication or they give her something to do. They're not all necessarily talking to one another. So we had to sort of sit down and look at the whole thing and rebuild it from the ground up. I had to reach out to some of her physicians who were prescribing different things and tell them, why I thought maybe that medication could be pulled out over time very responsibly. Because, for instance, she didn't need a muscle relaxer. She didn't have tight muscles. She didn't have muscle spasm. She had a central pain processing disorder. But oftentimes you get a prescription for something for the muscles because you perceive pain in the muscle. But it does help some people, by the way. It can help some, but usually the ones that it helps don't have classic fibromyalgia. Okay. They had myofascial pain syndrome or something involving the muscles themselves. So oftentimes you need to get to the right diagnosis. You need to get to the root cause. With her, following the protocol that I outlined in my book, this 21-day foundational program, and then going into other things that I go into the book in classic fibromyalgia, we were able to rebuild her, and within 60 days, she felt like a different person. And in fact, when she came back at her 3-month follow-up, she walked in my office, my front desk staff handed her new patient paperwork, even though they had met her multiple times, because she looked so different. She had a different energy. She was wearing new clothes. She had lost some weight. She had a smile on her face.
On some of them?
Off the majority of the medications. And she ended up, she was so different, my staff didn't know
We're going to
her.
take a quick break, but are there a lot of people with fibromyalgia? It's not something you hear about. Like I don't think I know anybody with fibromyalgia.
Oh, there are, Randy. You probably don't hear about it. If you know people that have it, you end up hearing about it. But, there's 5, 10, in some estimates of 20 million people in the United States that actually have classic fibromyalgia, and many more that are misdiagnosed with fibromyalgia that have
So
other
I may know
conditions.
people that have it. I
I'm
just
sure
think
you
they're
do.
depressed, or I think
I'm
that they're
absolutely positive you do.
introverts.
I'm positive you do. Some of them don't like to make it known. They kind of suffer in silence. They don't want to be a burden to people. They're not sure that you can do anything about it anyway, so they just don't tell you.
So medical doctors are endorsing your book, by the way.
Yeah, look at the back cover. I mean, I have experts from everywhere from Yale School of Medicine to Johns Hopkins Medical School that have read the book and wanted to write a cover endorsement of it. So yes, they are actually endorsing it. They're reading it. They want answers too, all right? They're struggling with these patients in their practice. Like many healthcare providers, they want to do a good job for them, but they know often in their model, the average patient-doctor time in normal routes of medicine in the United States is about 6 minutes. These patients take longer than 6 minutes.
You give specific how-tos in the book.
I do.
Like what supplements to take, what to eat, when to eat.
Right.
Things like that. How to get rid of your stress, how to start sleeping better.
Absolutely. It's a lot of the interventions are lifestyle interventions that the practitioner cannot do for the patient. The patient has to do them. So the patient has to work on their relaxation. They have to have a stress mitigation practice. They have to eat less inflammatory. They have to get some of these foods that trigger these kind of problems out of their diet. They have to eat clean in general, like you would want to if you were healthy. They have to learn a better circadian rhythm about their life. They have to have proper sleep hygiene, but they also have to learn, what supplements, what botanicals might help them, what medications might help them, and when certain medications are probably
and it's
not
outlined
going
in the
to help
book.
them. It is.
Because some people, right? Maybe they're in so much pain, they're not, they go, look, I don't care my mechanism or why this is happening. I just want to be fixed. So for that group, this can also work. If they take the advice and they're coachable.
Right. They can go right to the advice and try it, but I really find that most people with these kind of disorders, they do want to know what's wrong with them. They do. They want to know the answers. They want to know the mechanisms to the level that they're capable of really understanding them, not trained as a healthcare provider, not knowing biochemistry or neurophysiology, but they generally want to know what's wrong with them and why what they're doing might be likely to help them.
Now we're going to take a quick break, and people need to know it's a real interview. I'm not endorsing your book. I'm not even profiting from your book.
Of course not.
But
yes.
I read your book. It's an easy read, and your 21-day program. I was thinking, why not, right?
Yeah.
Because it's about eating better. It's an anti-inflammatory
Listen, anybody can do
diet.
that 21-day program. They're going to feel better on the back end.
Yeah.
That's not a cure for fibromyalgia. That's not a fix to reverse fibromyalgia in and of itself. That's sort of setting the stage, right? That's putting them at a good baseline to then figure out where they are in the book, and then you get deeper solutions and deeper action steps based on the root cause for your problem as an individual.
And we've talked on the phone. You think that some people that have been diagnosed with fibromyalgia will read the book and realize, I don't have fibromyalgia.
Oh, absolutely. Like I said, the medical literature is clear. Of the people who get, Randy, let me tell you about a research article that came out. Okay?
And then we're going to take a break, but this is good.
Yeah. They took a large group of fibromyalgia patients. In other words, patients diagnosed with fibromyalgia by their family practitioner or an internal medicine doc or even a rheumatologist. Then they sent them to an expert panel of fibromyalgia rheumatologists, basically, that were trained specifically in this at a high level. What they found is, using the diagnostic criteria that's commonly used, that the patients were diagnosed with fibromyalgia by physicians incorrectly 2/3 of the time. 66% of the time, the diagnosis was wrong when they were then seen by a panel of experts. So that answers the question. Will a lot of people read this book and then determine, hey, I don't really think I have classic fibromyalgia now. I think I might be in this bucket or in this
So
bucket.
there are a lot of rheumatologists, and we've talked in my green room, that are coming, that are in agreement with this style and this approach.
There are more all the time. There's a lot of rheumatologists.
You outline doctors how to find a doctor to work with them.
I do give information and resources on where there are search tools to find doctors of various specialties who also use a more functional, more comprehensive approach that includes lifestyle and diet and many of the other things that, quite frankly, in these kind of chronic, complex disorders, you have to do in addition to any medications or any medical therapies that are appropriate. It's bigger than that.
Okay, we're going to take a quick break. We come back, more about the book and more about getting started. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back. You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, reversing fibromyalgia. With us, we have an expert on the topic. In his own private practice, he has seen close to 1,000, or about 1,000 patients with complete reversals of diagnosed fibromyalgia. With us, we have the author of Fibro Fix, Dr. David Brady. Dr. Brady? So we haven't talked a lot about your private practice. So like, who's the typical patient there? Well, and where is it? It's in Connecticut?
It's in Fairfield, Connecticut. It's called whole body medicine. And Randy, every day in practice, I see reversals of many of these chronic diseases that are very complex, and they're not easily reversed with the normal routes of care where they go to a doctor and they see him for 6 minutes and give them a medication. It may help, but it doesn't get all the way there. Same with fibromyalgia. A lot of these patients come in and they're diagnosed with fibromyalgia, or they think they have it and they really don't.
Give me an example.
I have a woman come in just a couple of weeks ago. She came in, she had a lot of pain, had a lot of fatigue, she was constipated, just felt like she got hit by a train. And it turns out when we did really good comprehensive testing on her, we found out that she had a thyroid disorder that wasn't picked up. And when we got her thyroid right, she was better in the matter of a few weeks. She felt like a totally new person. In fact, in a couple of days, she felt a lot better.
Do they get frustrated? Because these are people that have been in pain for a long time.
They do.
Why was this missed?
Yeah, sometimes their initial reaction is they're angry. Why didn't they find that? I have had them say, I want you to call my doctor and tell them what you did, to get me better. And I'm like, well, I'm happy to have a discussion with them if they call me, but,
We are out of time. This is a great message. Who should get this book? Like when you write a book like this, ideally, who do you want it to be in the hands of?
Well, Randy, I spent years writing things for my colleagues, for physicians. This book was written primarily for people who are affected by the disorder. However, physicians are reading the book, healthcare providers are reading the book, and they're loving it. They're learning a lot. So I would advise them to read the book. But if you have chronic pain, particularly if you also have things like fatigue and anxiety and depression and gut problems, get the book, read the book. It's a roadmap for you to start your recovery. But also, if you're a family member of someone suffering.
Like your spouse. You say it's mostly a female disease or problem.
Exactly. Read the book so you understand their problem better, and have them read the book and go on the journey of recovery together. They need your support.
I read the book, and like I said, I'm not trying to endorse you on this program, but it seems easy as I'm reading it.
Listen,
and I can't help but think, can it be this easy?
I tried to make it easy. That's what the book is about. It's about giving knowledge, empowering patients, but giving them direct roadmaps and action steps on how they can build this into their life today and get on the road to recovery. So I tell them exactly what kind of movement, what kind of exercise is safe for you, what kind of things you need to do to change your diet to make it more healthy in your situation.
But don't they have to work with a medical doctor, especially if they're on like 8 or 9 medications that could work in combination with this protocol?
If it's anything involving medications, whether it's finding the appropriate medication, getting off a medication, changing the doses of medication, then absolutely have to work with a physician. I did not make the book dependent necessarily on you working with a physician, but I highly advise throughout the book that you do, and that you find a physician who understands fibromyalgia and global pain syndromes at a higher level than many do. So I give references on how to find those kind of physicians.
Do you get referrals from medical doctors?
I do.
All the time?
Yeah.
Because what do you do with these patients? It must be very difficult.
Well, I get the most difficult ones, but that's rewarding.
Why do you like this kind of a chronic pain patient? Because all of the medical doctors I talk to, they don't want to deal with this because it's so challenging. Why you? Why is this your...
I like it because of the challenge, number one, but I just feel like there's such a need there. It's an area in conventional approaches to medicine that they're not doing a very good job on, frankly. But we see results, so there's hope. They need to just get to the right pathways to start their recovery. And if I can help facilitate that, either through seeing the patient directly or through the book, then that's why I went into this in the beginning. That's why I became a doctor.
Now, can they see you directly? I mean, could they do this over the telephone with you?
No, unfortunately, they can't do it over the telephone. They can come see me at my practice in Connecticut, in Fairfield, whole body medicine.
Do people fly in there to do
No, I
this?
have people flying from all over the world to see me. But if they read the book and put the action steps I outline in the book, and they work with a physician, I give ways that they can find a physician locally that will do a good job with them. That's another option for them. I'm certainly happy to see them if they can come to Connecticut. If not, read the book, find someone local, and I think you still will be very successful.
Now, we should mention, of course, results vary, but you've seen a lot of people with reversals. So I want to thank you for coming on the show.
Absolutely, Randy. Thank you very much for giving me the time to get this message out.
All right, thanks again. You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.